Our next company presentation is from Phytoceuticals, and we will be hearing from Mr. Tyler. Mr. Edward Tyler founded Phytoceuticals in 2007 and has been the CEO since 2007. Prior to that, he founded Gopher Equity, an internet-based platform for early-stage financing. He also founded Bridgeworks, a venture capital boutique, which was the genesis of Phytoceuticals. Mr. Tyler?
Thank you very much for your kind introduction. Before I dive deep into our subject, I would actually like to share with you some more intimate information about myself, my morning ritual. So when I got up today, I actually did dry my hair with a hair dryer. The next thing I did was I had a double vodka. And after that, as you can imagine, I needed some food. I had a hamburger, a big one. And yeah, it's not hard to tell, I felt very bad afterwards. There happens to be a very interesting correlation between my very intimate morning ritual and the history of wound care. So, until the 1960s, wounds were treated with a hairdryer. They were just basically dried. In the 1960, the paradigm shifted 180 degrees. Since then, it's clear wounds are treated moist. And what have we seen since then? What we see today is a huge sea of all different types of dressings, very technical dressings, a dressing for every little step in the wound healing process. And due to being very complicated, a lot of wound specialists often use dressings on top of each other, which actually does not benefit the healing process. And it's not difficult to think about it. Efficacy, unfortunately, very disappointing. So, what's the current need in wound care? Well, from a patient perspective, if you imagine somebody with a serious acute or chronic wound, what they want their wounds healed, quick, without pain. That's clear. From the perspective of a wound specialist, what do they want? They want a product that is easy to use and effective. Ideally, one product for all types of acute and chronic wounds, one product for all phases in wound healing. And of course, the therapy has to be cost effective. So Phytoceuticals, what we do, what we have done the last 3 years, we have looked at the natural products available and have tried to come up with a solution for this challenge. We are a team of 6 people that worked the last 3 years on developing our solution. Our solution is one primary wound dressing. One primary wound dressing is a simple, natural, and effective application for acute and chronic wounds. It is a spray based on a specially formulated combination of hypericum oil and neem oil. It is one product for the wound bed, the wound edge, and the peri-wound skin. And one can only do this because it comprises all the 4 main effects you want in an advanced wound dressing. So let us see how simple our application is.
Haben Sie seit dem letzten Verbandwechsel Schmerzen gehabt?
Nein.
Nicht? Gut. Dann nehmen wir jetzt den Verband weg.
The application of One is very simple. After removing the old dressing, perform a basic wound cleaning if necessary. Once granulation begins, wound cleaning may be omitted. One is then sprayed directly onto the wound bed, the wound edge, and the peri-wound skin until the wound area is covered with a thick oil layer.
Wir sprühen direkt in die Wunde, auf den Wundrand und die ganze Wundumgebung, sodass die ganze Wunde und die Umgebung von einer Ölschicht bedeckt ist.
Let the oil disperse for at least 2 minutes until you see an even oil layer over the wound and the wound area. After application of one, cover the wound with an appropriate secondary dressing. The recommended dressing is a non-woven gauze or an absorber that is adjusted to the wound exudate.
Ohio-based Accord
Is one also an effective product? Since we received the CE notification back in November 2010, we have performed over 80 observational studies, cases, where we looked at all different types of acute and chronic wounds. We have started with severe acute wounds and will then penetrate into the field of chronic wounds. So I would like to share with you 3 examples of wounds, of typical wounds that we have treated. What you see here on the first slide is a pressure sore that was treated during 10 weeks. The second one is a very classical chronic wound, an arterial leg ulcer. And the third one is, like the example in the movie, a post-surgical wound. And I would actually like to take this example to explain to you the power our product has. So when you look at the wound after the surgery, you see a wound that is cut down to the bone. And this is something in wound care which often is a very serious problem, because those wounds often don't heal or heal very, very slow. So what we have done here, we have applied one for 7 weeks. And what you see is especially interesting is the phase between after surgery and week 3, where you see that the wound granulates very quickly. It does that without any contamination. So the antibacterial capacity of the product helps to support the wound healing process very strongly here. So this wound was just treated with this spray inside the wound edge, and the peri-wound skin. So one primary wound dressing is our first product. It is a medical device in Europe, and we are at the moment looking at the 510(k) process in the US. This product targets healthcare professionals, and the sales process was started in Switzerland, our home market, 3 weeks ago. And internationally, we will enter into distribution partnerships for international sales. Besides this product, one primary wound dressing, we are also looking at an OTC version of the product. We are looking at animal health, where the initial results have been very, very interesting, and also the market of inflammatory skin disorders. All these formulations are based on the same combination of natural extracts, for which we have patent protection. The market is obviously a very big market in terms of numbers. The interesting thing about the market is that the key value drivers are age, diabetes, obesity, factors which are not going to reduce over time. We are going to penetrate the market with a price of $90 per spray. At 20 applications a spray, this means $4.50 per day, which is well below the benchmark of $8. We estimate our peak sales potential to be 250 million and break even in 2013. So I hope you have seen that I'm actually very passionate about our product. And I can say a lot. It always comes from the company. So I'm actually more happy that I can announce today that our product, our technology, has been observed from an independent third party. And I'm happy to announce that we have received the Frost & Sullivan 2011 Innovation Award for our product. Thank you very much.